Hello and welcome everyone. I am Dr. Madhushri Datta and today we will be exploring a comparative materia medica focused on liver related remedies. Let us dive right in and get started with this insightful journey. So, today we will be discussing this following medicines related to your liver, that is cardias, cheridonium, hydrastis, cholesterinum, leptandra, carica papaya, which is an Indian drug, myrica cerifera, and cholesterinum. And as I said earlier, this will be a session on comparative materia medica. So let us begin. First in the list we have Cardias marinus, also known as St. Mary's thistle. It has got a noticeable recognition for its beneficial action on liver-related conditions. It has pronounced action on the liver and the portal system, leading to soreness, congestion, jaundice, and, in advanced stages, cirrhosis of liver. One of the key contributing factors in this medicine is overconsumption of alcohol, particularly beer. This is a very important point to note. Overconsumption of alcohol, particularly beer, is one of the key contributing factors. Predominantly, the left side of the liver is affected, causing symptoms such as nausea, retching, and vomiting of a distant greenish acidic fluid. This character of vomiters is also very significant. Greenish acidic fluid. Two notable characteristic modalities are symptoms worsen with deep inspiration and with motion. Please remember this, symptoms worsen with deep inspiration and with motion. Upon examination, liver is engorged, particularly the left side, with enlargement occurring in the transverse direction. Now, in contrast to remedy like chelidonium, which is also causing liver enlargement but in the horizontal direction. Now, a brief summary of this medicine. Left-sided liver-related distress, aggravation on deep inspiration and motion, distant greenish vomitus, which is acidic in nature, particularly linked to alcohol misuse, beer especially, resulting in liver complications. Now let us move on to the next one, that is chelidonium. Chelidonium is a notable homeopathic remedy that primarily affects the liver, leading to congestion, inflammation, and degeneration. Unlike cardias, chelidonium do not provide us with a history of overconsumption of alcohol. Instead, we will get a predominant causation, that is biliary colic or bile stone affections. And it is particularly indicated for gallstone colic characterized by sharp lancinating pain under the lower and the inner angle of scapula, which is in fact a distinctive feature of chelidonium, that there is pain in the lower and the inner angle of the scapula. Please do remember this. Patients may experience nausea, vomiting, and a bitter taste in the mouth. In terms of guiding symptoms, chelidonium is a right-sided remedy, unlike cardias, which was left-sided we have seen. In chelidonium, we have a notable craving or a desire for very hot drinks. This is very important in chelidonium, that we have a desire for very hot drinks, and there is a marked amelioration of symptoms after dinner as well as after consuming warm or boiling drinks. So patient desires boiling drinks and the symptoms are ameliorated after that. The tongue of chelidonium appears to be yellow coated with red edges and tooth imprints are also present. The stool is typically clay colored or yellowish. Summarizing, chelidonium is distinguished by its liver-related indications, right-sided complaints, craving for hot drinks, and the characteristic pain under the scapula. Please do not forget this point in chelidonium because it's one of the most important ones. Now let us move towards the next medicine which we have that is Leptandra. Now coming to Leptandra, this is another important homeopathic remedy particularly noted for its action on the liver and the portal system. It also is also a very good remedy for portal hypertension apart from its predominant action on the liver. So just like Cardias, Leptandra also addresses the transverse enlargement of the liver and portal hypertension. A distinctive feature of Leptandra is the presence of significant burning sensations. So in Leptandra, we have a significant burning sensation. And this medicine is also characterized by its stool, which is notably black, tarry and fetid stool, often accompanied by pain around the navel, typically more intense in the morning. So please note the stool of Leptandra, black, tarry, fetid stool. Okay, pain around the navel, typically more intense or aggravated in the morning. Now let us compare this medicine. In contrast to Chelidonium, which has got a desire for hot drinks that relieve the symptoms, Leptandra patient crave for cold drinks. However, these cold drinks actually aggravate the burning and the aching pain in the stomach. Additionally, Leptandra is known for its association with hepatohemorrhagic diathesis, similar to the hemorrhagic tendencies observed in Cardias. Summarizing this medicine, Leptandra is distinguished by its liver enlargement, remember transverse direction, burning sensation, very important in Leptandra, burning sensation, black tarry stool. This characteristic stool is very significant in Leptandra, black tarry stool. Okay, and an aggravation of symptoms with the cold drinks. The patient craves for cold drinks and there is aggravation of the symptoms after taking this cold drinks. Okay. Now let us move towards the next medicine, which is Hydrustis canadensis, commonly known as golden seal and belonging to the ranunculus family, is another homeopathic remedy with notable affinity for liver conditions. It is particularly indicated for individuals whose constitution has been compromised by excessive alcohol use, which is similar to Cardias, which also relates to the history of alcohol abuse. In Cardias, we have seen in the beginning only there was a history of alcohol abuse, especially beer. So similar type of constitution or similar type of history we will get in case of Hydrustis also. One of the hallmark characteristic of Hydrustis is its ropey, yellow, thick, stringy secretion. So please remember this hallmark characteristic secretion, thick, yellow, ropey, stringy secretion. The tongue of Hydrustis patient is typically swollen, wide, flabby, often showing tooth imprints and a sensation as if burnt. Remember this. In terms of liver symptoms, hydrangea is a right-sided remedy similar to your Chelidonium, with an enlarged heart and nodular liver along with jaundiced skin. So on examination of the patient in hydrangea cases, we will find the liver is enlarged, heart and nodular, and along with that obviously jaundice will also be present. Now the stool of hydrangea is notably white or even very light colored, indicating the absence of bile. So notably light or even white color indicating the absence of bile. This is in contrast to Chelidonium stool, which was the stool of Chelidonium we have seen, it was clay colored stool. The stool of Leptandra, what we have seen, black, tarry, fetid stool, pain around the navels, and it was aggravated during the morning. Now, hydrangea also shares some similarities with Bryonia alba in its modalities. That is, both of them have similar modalities, aggravation from motion and relief from absolute rest. However, the stool is the characteristic for distinguishing these two remedies. In case of your Hydrustis, the stool is light or white in color, but thus distinguishing it from Bryonia. Okay. In additional, symptoms can be eased by passing flatulence and applying pressure, which is a thing in hydrostis. Now, in the comment box, please write down what was the characteristic stool of Bryonia. Now let us move on to the next medicine, cholestyrinum. It is a notable homeopathic remedy specifically recognized for its efficacy in the treatment of gallstone colic. So it's a specific medicine for gallstone colic, what we call it. So in addition to its role in gallstone cases, it is reputed for its usefulness in addressing liver cancer and persistent hepatic enlargement as well. Symptoms often present as sudden intermittent attacks of pain in the bile duct region accompanied by extreme soreness and sensitivity in the liver region. The affected region is highly sensitive to touch, motion, or even slightest jarring. Patient often find relief by lying on their side, on that affected side and may instinctively hold its side while walking. Why? To reduce the discomfort. Okay, so this is a thing in cholestyrinum. It's a very important medicine and short medicine and specific for your gallstone. Now let us come to the next one. This is a very good medicine, that is Carica papaya. In fact, it is an Indian drug which is known as pepe in Bengali and papita in Hindi. So Carica papaya, a well-known remedy which is derived from papaya fruit. It's traditionally used in cases of liver and spleen enlargement, often accompanied by fever. A key characteristic is the patient's white-coated tongue. Please note that tongue, white-coated tongue alongside a distinct intolerance to milk. This is also important. Distinct intolerance to milk is seen in Carica papaya patients. Okay. This remedy is particularly useful for individuals who struggle with digesting milk or meat, often experiencing dyspepsia and weak digestion. As a result, they may pass small amount of stool frequently throughout the day. So this is the problem with Carica papaya patient. They have very weak digestion. They cannot digest milk or meat. They experience dyspepsia. They experience weak digestion, and Carica can correct this point. In comparison, Chelidonium presents with a stool which is clay or yellow colored. In Carica papaya, due to this weak digestion, patient used to pass small amount of stool frequently throughout the day. So this is a stool of Carica, and in Chelidonium it was clay or yellow colored stool, and the patient often finds relief from very hot drinks. Now coming to Leptandra. In Leptandra, the stool was dark, tarry, and morning pain around the navels, with cold drinks worsening the burning sensation in Leptandra. Coming to hydrostis, what we have seen, hydrostis by contrast features a light or white colored stool indicating of bile deficiency. Now let us turn towards the another medicine, that is Myrica cerifera. Myrica, this remedy is particularly effective in cases of jaundice accompanied by persistent sleeplessness. The patients typically have a bitter taste in the mouth, loss of appetite, and thick tenacious secretions. Their urine is scanty, yellow, and frothy. And as well as if you see the character of stool in Myrica, the stool is loose, ash colored, and devoid of bile. This is somewhat similar to hydrostis. Stool in Myrica is loose, ash colored, devoid of bile, somewhat similar to hydrostis. In Myrica, there is also a notable urgency to pass stool, often resulting in expulsion of gases. So there is a notable urgency to pass stool, often resulting in the expulsion of gases. Now summarizing, each remedy has got distinctive pattern that guide us their use, especially in terms of digestive issues, liver conditions, their appearance of the tongue, and as well as of the stools. So if you like this video, then please do like, share and subscribe for more updates. Thank you so much.